What is a medically underserved region? It's a term you hear a lot regarding the health of certain communities, but what exactly does this term mean and what are the metrics for it? Because once we know what causes these underserved regions to appear and how those causes affect certain populations, then we will all have a better understanding of what we can do to advocate for healthcare equality. While different departments have slightly different definitions, overall a medically underserved region is an area with a lack of access to healthcare services, especially for small subsets of the population with specific cultural, language, or economic barriers to care. You'll know you're dealing with a medically underserved region if there is a lack of access to healthcare providers or just a general lack of familiarity or access to healthcare. There are many factors which restrict access to healthcare, which leads to the growth of more underserved regions. And these barriers to healthcare are 1. Lack of coverage. Without health insurance, people are more likely to forego needed medical care because of the high costs, which can lead to late diagnoses, delays in medical care, overall worse care, and worse health outcomes, which is especially severe for those with chronic illnesses and those seeking preventative care. 2. High healthcare costs. Even with insurance, healthcare costs are a huge burden for the average person and can lead to many foregoing needed care. 3. Inconsistent sources of care. Areas in which the populations don't have regular doctor visits and only go during emergencies can be classified as underserved. 4. Low health literacy. Areas with especially low health literacy can constitute an underserved region, and it's a huge barrier to healthcare access. Those with limited English proficiency are 18% more likely to forego needed care and are 57.6% less likely to have regular doctor appointments. 5. Lack of transportation. 3.6 million Americans forego needed medical care because of transportation issues, whether that be a lack of access to a vehicle, inadequate public transportation facilities, or long distances to the nearest medical center. And 6. A lack of providers. A huge barrier to healthcare access is the lack of medical professionals. Along with increased burnout, a shortage of physicians, especially primary care doctors, in underserved regions is leading to delays of care, lack of access to healthcare, and overall worse health outcomes for patients. Whether that be for higher salaries, better equipment, or better conditions, physicians tend to migrate and practice in more affluent urban and suburban areas, leaving rural and inner city populations underserved. And those fewer doctors are typically stretched out way thinner, with higher patient volumes and longer hours. And one example of how drastic this disparity in provider access is, 20% of the US population lives in rural areas, and yet only 9% of physicians practice in them. And this issue is only magnified for specialties. Doctors who specialize are way less likely to practice in rural areas than urban areas. Although there are many more, these are some of the biggest barriers to healthcare access, and areas facing these issues can be classified as underserved.